Order.
Prime Minister's questions.
Member for Barataria Sunwing.
Would the Prime Minister state whether the government will be amenable to changing the Magdalena Grand Hotel to a time-sharing or rehabilitation hotel, or even a hotel with a similar plan as Sandals?
Prime Minister.
Madam Speaker, the process to select a long-term operator for the Magdalena Grand Hotel is advancing. It is premature at this stage to determine what the terms and conditions would be. The process has to be allowed to continue, and this is a matter being pursued by a cabinet-appointed steering committee under the purview of the Ministry of Finance.
Member for Princestown.
Thank you, Madam Speaker. Madam Speaker, question number 2 to the Honourable Prime Minister. Could the Prime Minister indicate whether there was a cost involved in the production and airing of his two-part program entitled Mind Your Business? And if so, will he disclose this cost?
Prime Minister.
Madam Speaker, with respect to the airing of that informative program, which has found widespread public acclaim and acceptance, there is no cost to the state because the government has used its facility under the license management that exists with the broadcasting agencies. With respect to the production, Madam Speaker, all the costs are not in, but as soon as they're in, if the appropriate question is filed, then can be made available. But I just want to advise members on the other side that in this life, there's nothing that is free. The cost exists. And I can guarantee you, Madam Speaker, and the national community at large, that the cost of that production is minuscule as compared to what they were paying for communication before.
Supplemental, Member for Puchis.
Thank you. Thank you very much, Madam Speaker. Would the Prime Minister indicate, just for the public record, that being a recorded two-part series, when exactly was the program or were the programs recorded, where and to what audience?
Prime Minister.
Madam Speaker, the program was recorded in Trinidad and Tobago at Napa a couple of days before it was broadcast, and it was aired to a public audience.
Supplemental, Member for Princestown.
Thank you, Madam Speaker. Would the Honourable Prime Minister be kind enough to indicate whether or not the production of the two-part series was contracted out to a private entity?
Prime Minister.
Madam Speaker, the answer is yes. I mean, some production house that does that kind of business would have been engaged by the Ministry, by the Prime Minister's office, and that is why we have a cost to pay.
Supplemental, Member for Orpooch West.
Prime Minister, you said the sum was minuscule. Can you indicate what is minuscule?
If you compare a flea with an elephant, the flea is minuscule in size. The flea is minuscule in size and the elephant is large.
Member for Princestown, supplemental.
Madam Speaker, to the Honourable Prime Minister, can the Honourable Prime Minister indicate whether or not the Darrell Duku network was involved in this production?
Prime Minister.
I'm not aware of any production by any production house called Darrell Duku Network.
Member for Faisabad.
Thank you, Madam Speaker. Question number 3. Could the Prime Minister indicate when he expects the Couva Hospital to be available for use by citizens of Trinidad and Tobago?
Prime Minister.
Speaker, as I've indicated before in this House, there's an initiative with respect to the export of health care using this facility. And the government of Trinidad and Tobago, through the Ministry of Health and the University of the West Indies, are engaged in putting that in place. It's taking a little while longer than we had anticipated, but we have been advised by the University of the West Indies that they are moving as fast as they're able to. However, Madam Speaker, a special purpose company was established in mid-2018, and consideration is being given to engaging an operator for a phased operationalization of the hospital later in the year. Thank you.
Supplemental, Member for Faisabad.
Thank you for that answer. Prime Minister, can you indicate whether any provisions for the engagement of local healthcare workers are part of the operational arrangements for this hospital?
Prime Minister.
I couldn't give you the exact details now numerically or otherwise, but certainly it will be an opportunity for healthcare providers of the best, of the highest quality and in numbers to be available in that hospital to provide healthcare for the national population, but with a focus on exporting healthcare services.
Supplemental member for Karen East.
Mr. Prime Minister, would you be kind enough to indicate what you may consider, from your governance perspective, the phased introduction for use at the hospital, which you were discussing with the
Madam Speaker, I would not engage in guesswork at this stage, but I would rather wait until the final arrangements are worked out by those who are charged with the responsibility. And I'm sure with a little bit of patience, all those details become available. Because, Madam Speaker, it is a novel initiative being done for the first time. And the participants are being very careful to ensure that the work is done properly and that when it is made available to the public as a position to be advanced, that it is accurate and workable.
Supplemental member for Faisabad.
So can you give any assurance that Trinidad and Tobago citizens will not have to pay for services at this hospital?
Prime Minister.
Madam Speaker, this hospital is meant to be a fee-earning entity, and that's why we're talking about exporting healthcare services. However, as I said at the very beginning, charges applicable to citizens of Trinidad and Tobago will be borne by the government of Trinidad and Tobago in the same way that we are carrying charges in other hospitals.
Supplemental member for Barricari Sunwing. Supplemental member for Caroni Central.
A role was announced for the University of the West Indies in this matter. Can you clarify what that role might be, or do you know at this point?
Prime Minister.
Madam Speaker, as I said before, this approach is dealing with a number of issues, and I was very clear in this House as to outline what it was. It started with a requirement for the government of Trinidad and Tobago to discharge its responsibility to the University of the West Indies, where there was a claim of over $200 million owing to the university. The university was in the position where, had those monies not been paid and paid promptly, that the university accounts would have been in danger of being qualified. The government of Trinidad and Tobago, requiring to discharge that responsibility in our current financial situation, agreed to use the asset-based arrangement, using an asset that we had in hand to discharge that payment. And therefore, the University of the West Indies accepted that it be paid by an involvement of this asset, an asset transfer. Having agreed to do that, we went further to set up the arrangement I just mentioned, where the University of the West Indies and the government of Trinidad and Tobago, through the Ministry of Health, will operate a hospital for profit, providing additional training and services to the local and the international community. And that is what is being worked out, and that's why it's being delayed a little bit like that. So, Madam Speaker, that is as far as I can go now. We do not have the final arrangements because that is being worked out. And as soon as those final arrangements are available, Madam Speaker, as the government always does, it will make it available to the population.
Central. Question number 4.
Yes, Prime Minister. Could the Prime Minister inform the House whether the relationship with any of the existing rating agencies has been severed by the government of Trinidad and Tobago?
Prime Minister.
Madam Speaker, I don't know where that question is coming from, but I will say, Madam Speaker, that the government currently has contractual arrangements known to all and sundry with 4 credit rating agencies. 1, Moody's Investors Services. 2, Standard & Poor's Global Ratings. 3, Fitch Ratings. And 4, CARICRIS, the Caribbean Rating Agencies. And if there's any question to be asked, Madam Speaker, about this issue of credit rating, the question really should be whether the government has added another credit agency, rating agency, because that's what we've done. Rather than sever any agency, we've added an extra one. So Fitch is now overlooking our rating considerations.
Member for Oropouche West.
Speaker, Could the Prime Minister inform the House? As it relates to a meeting, as it relates to a meeting between the Prime Minister, CIC Capital Corporation, and China Zenma Oil Company, can the Prime Minister enlighten the House as to the nature of this meeting?
Prime Minister.
Madam Speaker, CIC China Investment Corporation is the owner of 10% of Train 1 at Atlantic LNG. The other shareholders are BP, Shell, and the National Gas Company. The meeting with CIC paying a courtesy call on the Prime Minister of Trinidad and Tobago is just that, to discuss and inform on matters of a shareholder interest, where these shareholders are engaged in sensitive negotiations at this time, Madam Speaker. And this is a matter between the shareholders, and a meeting in the office of the Prime Minister is a courtesy to inform us as to where these discussions are, what the company's position is, and as such, the Prime Minister will keep those confidences.
Member for Caroni East. Member for Oropouche West, question 6.
With regard to a recent meeting between the Prime Minister and executives from the Sunwing travel group, can the Prime Minister inform the House if it is the government's intention to sell Magdalena Grand Beach Resort and golf course to Sunwing Travel Group?
Prime Minister.
Madam Speaker, once again, I don't know where this question is coming from. The government cannot sell what it doesn't own. As far as I'm aware, the golf course in Tobago at Magdalena is not owned by the state agency. And Madam Speaker, with respect to the visit to the Prime Minister's office by Sunwing, it is again, once again, the government's encouragement to foreign investors and support for investors in the business of Tobago. And the government has, at this stage, no discussion with Sunwing or anybody else for the sale of the Magdalena Hotel. What we have, Madam Speaker, is an open door to Sunwing and to any other well-known international brand that might lift Tobago's tourism plant. Some we pay to look for, others come through on their own, but the door is open as we search and continue to search for an international brand for the Magdalena Grand Hotel.
Member for Caroni East.
Could the Prime Minister state why the government has not, or has to date, not hired more nurses and doctors for the public health care system?
Prime Minister.
Madam Speaker, the hiring of nurses and doctors for the public health care system is not an open-ended process, as you would know, Madam Speaker, and as the member who asked the question would also know. Being a practitioner in it, there's an establishment in the healthcare system, and there's an appropriation authorized by this Parliament to pay doctors and nurses, and within that appropriation, which is a fixed sum of money, the normal hiring processes are at work. However, Madam Speaker, those who operate the system would know, and as we are now on the verge of taking delivery of 2 or possibly 3 new facilities, because we have Point 14, we have Arima, and we have the details of Couva to come, there is a need for this Parliament to expand the provision for the recurrent for doctors and nurses, and that will be addressed by the appropriations authorities as we go forward. Thank you, Madam Speaker.
Member for Caroni East.
Honourable Prime Minister, could you tell the nurses and doctors who, hundreds of them who are waiting jobs and are unable to get jobs, what advice would you give to them and tell them to help them and comfort them while they await their jobs and there are no jobs available for them?
Madam Speaker, what I will say to such persons is that opportunities will continue to become available in the public health system, and we will fill those and use those as the appropriation allow. But, Madam Speaker, there's also the possibility that these specialists, especially doctors, who are qualified in Trinidad and Tobago, it may be that the time has come that some of these doctors, qualified to do so under law, may not only look to the public health sector for their career. Doctors can work outside the public health sector until they do get an opening, if they so desire to look for one in the public health sector. It is quite wrong to assume that if a doctor is not holding a job in the public health sector, that there is no opportunity for him to practice or her to practice as a doctor. Because my understanding is, once you're certified by the competent authority, a doctor can practice within those certifications anywhere in Trinidad and Tobago.
Supplemental member for Caroni East.
Honourable Prime Minister, as you are quite aware, having been associated many years through with colleagues in the health sector, when these young doctors come out, if you unleash them into the general population, are you not considering that the population will be shortchanged as a result of an intern coming out and just going into general practice without getting hospital experience?
Prime Minister.
Madam Speaker, nobody is talking about unleashing anything. These are people who are certified by a competent authority, and I'm sure, Madam Speaker, that my colleague knows what I'm talking about, which is practicing within the level of their competence. They certainly won't be able to practice as specialists. But, Madam Speaker, there are large areas of this country which are unserved and would be happy for a young graduate to come there and do even volunteer work, Madam Speaker, especially when many of these graduates have been supported by the taxpayers of Trinidad and Tobago. Also, Madam Speaker, in recent years, we have developed a significant component of private sector healthcare delivery, where some of these persons can practice. But one's career does not start at the top in every instance. So all I am saying, Madam Speaker, is insofar as the public health sector is absorbing as many as possible within the allocation that the Parliament has approved, let us not close the door to doing something different, especially from young people who want to serve the rest of the national community until their perfect job has arrived.
Sir, could you consider two things? One, a lot of these doctors are not fully registered and they are temporarily registered and they will need to change the registration status. Would you consider that, one? And two,
One question.
And two, the question is, would you consider differential salary for these doctors so they could operate in the public health sector
All right,
also?
I allow that. Prime Minister.
Mr. Speaker, if we are disposed to doing things differently to get a different result, then all the requisite changes and recommendations ought to be considered, can and should be considered. And that's exactly what I'm saying.
Supplementary member for Faisal.
Thank you, Madam Speaker. Prime Minister, with regards to your suggestion that perhaps some of these doctors can serve in a voluntary status, there are legal implications with regards to medical coverage. Will you consider providing or looking at providing the framework for that kind of arrangement in the public health facilities?
Madam Speaker, I don't want to be misunderstood because I know what the headline is going to be. And the headline is that I'm asking doctors to work for free. I'm not saying that. My colleague from Barataria will speak about the registration. Madam Speaker, these are all components of a solution to a problem that exists. And all that I'm saying is that these are the things that we should be looking at to ensure that the people that we train don't just sit there and be frustrated and unregistered while doing things differently, can bring them on board in a different place, in a different way, within their competencies, and we will have a more perfect, or I shouldn't say more perfect, a more effective healthcare delivery system. That's all I'm saying.
Member for Caroni Central.
Could the Prime Minister confirm whether between September and December 2015, the Minister of Finance made 6 requests for dividend payments from the National Gas Company of Trinidad and Tobago?
Prime Minister.
Madam Speaker, between 15 and 16, the Minister of Finance made 1 request for dividends to be paid in increments between September and December. These included $1.5 billion for the special dividend from the IPO from the TTNGL. And in order, given the financial status of the NGC, this request to have the dividend paid in increments was an understanding of, was a response to the circumstances. And that there was a total of $2.1 billion in ordinary dividends, interim dividends, and these dividends were budgeted for, debated, and passed in the budget of 2016.
Supplemental, member for Carney Central.
Yes. Were there further dividends received in 2016?
Prime Minister.
Madam Speaker, the member asked a question about 2015. I came prepared to answer about 2015, and the member ought not now to extend it to the 2016 and try to ambush me.
I appreciate Madam Speaker.
Member for Naparimo.
Thank you. Chair. Question number 90, Prime Minister. Could the Prime Minister indicate what debt-to-GDP ratio threshold his government has set for the management of our economy, and any measures he intends to adopt to not exceed the identified ceiling?
Prime Minister.
Madam Speaker, as the wheel spins, I direct my friend to the business of this House, where he was a part in 2019, to page 8 of the medium-term outlook. And with your approval, Madam Speaker, I would like to quote one paragraph for the benefit of my member, of my colleague, who has a document provided to him by this House, and it reads as follows. The public sector debt will remain sustainable over the projected period 2018 to 2021, and within the acceptable international benchmark of between 65 to 70% of GDP. An increasing use of non-debt creating financing options will ensure that the public sector debt remains sustainable. Madam Speaker, that paragraph is in this document, which the member has a copy of, and I don't know why he's taking the Parliament time asking me to read for him when he can read.
Supplemental, member for Naparimo.
Prime Minister, answer the question, please, in the second part. What measures he intends to adopt to not exceed the identified ceiling?
Prime Minister.
Madam Speaker, when one cannot read is a problem. When one cannot read and cannot understand is a bigger problem. Madam Speaker, that question is answered in the second part of that paragraph, which says, an increasing use of non-debt creating financing, those options will ensure that the public sector debt remains sustainable. Madam Speaker, this is the answer to an urgent question, the answer being published in this House since October last year.
Supplemental, member for Naparimo.
Indicate 3 examples of non-debt financing that you spoke about.
Prime Minister.
Madam Speaker, if the member wants to get on like that, I will direct him to the Minister of Finance and file the question in an appropriate way.
Member for Naparimo.
Question 10. Could the Prime Minister give reasons why, at this critical juncture in our diplomatic relations with Venezuela, our country has no ambassador resident in that jurisdiction?
Prime Minister.
Madam Speaker, as part of the ongoing arrangements of managing our affairs at the Ministry of Finance, in the search for a director, inspector of missions, it was deemed that the ambassador who at that time was located in Venezuela was the best person for the job, and the government has recalled him and has assigned him to that position of inspector of missions. That being so, Madam Speaker, a vacancy has occurred there. In the interim, all our business with Guyana have been handled with Venezuela. No, I'm mixing them up. No, Madam Speaker. All our business, Madam Speaker, relating to that country was being handled out of headquarters as we go through the process of seeking agreement to appoint a new ambassador to that country.
Given the number of changes in diplomatic postings, this being one, why it is that it could not be a seamless transition where one would have left and an appointment made?
Prime Minister.
Why is it?
Madam Speaker, I'm not sure what equation the member is using to come to that conclusion, but as I said, the movement of staff, promoting, retiring, filling vacancies, seeking agreement, these are all ongoing business of the Ministry of Foreign Affairs and the country of Trinidad and Tobago, and I do not know what the member is getting at in implying that one could turn a wheel here and end up in a direction over there.
Member for Couva South.
Thank you, Madam Speaker. Given the withdrawal by, given the collapse of the Sandals Tobago project, could the Prime Minister inform this House of what alternative projects will be pursued by the government to boost tourism in Tobago?
Prime Minister.
Madam Speaker, contrary to what has been said that we were entirely standing on and depending on Sandals for our initiative in Tobago, we are prepared to act and we are engaged in talking to any acceptable entity that is interested in identifying Tobago as a location of interest. And Madam Speaker, with respect to the existing plans that are in Tobago, the government recently doubled the incentives under the Tourism Accommodation Upgrade Program, which provides rebates for accommodation providers for small as well as larger facilities from 1 to 5 rooms and from 6 to 150 rooms, increasing the rebates from 20 to 40% for the first category and from 25 to 50% for the second category. The government has also increased the government loan guarantee program for tourism-related business in Tobago. The subsidy increased from 2 to 5% on approved new and restructured tourism-related loans. The length of the repayment has been increased from 7 years to 15 years. Further, the government has appointed a steering committee for the selection of an operator for the Magdalena Grand and Golf Resort and is currently evaluating the final proposals. Qualified proposals are currently being considered. It is noted that there may be need to undertake enhancement to the facility, such as a breakwater, beach enhancement, and a refurbishment of the hotel plant. And Madam Speaker, as we continue to advance Tobago as a potential jewel in the Caribbean, all investors who are interested in investing their money in a great place will continue to consider Tobago and meet a government with a door wide open to encourage them to select Tobago as their location of choice.
Supplemental member for Couva South.
Thank you, Madam Speaker. Could the Prime Minister assure this House, given whatever agreements that are realized going forward in relation to boosting tourism in Tobago, those agreements will be laid in the House of Representatives in relation to transparency and accountability?
Prime Minister.
Madam Speaker, as is necessary and as we have done as a government, at the appropriate time, all appropriate documentation which are required to be laid in this House will be laid in this House.
Supplemental member for Baratari Sunwing.
Minister, could you indicate which, if it's THA or the Cabinet, which one is responsible for approving an offshore medical school in Tobago?
I really would not allow that as a supplemental question.
It's a project.
Based on what is happening. The project is to boost tourism.
But that is
Member for Couva North.
Thank you, Madam Speaker. Honourable Prime Minister, given the withdrawal by Sandals Resort from the government's intended Sandals Tobago project, could the Prime Minister state whether there was a cost to the state and would he disclose this cost?
Prime Minister.
Madam Speaker, as has been said publicly before, there is no cost consequent upon the withdrawal. Sandals has borne its cost of whatever they were engaged in, and of course whatever the government has engaged in, for example like the survey of the parcel of land that was under consideration, the topographic survey and any other, including the acquisition of the parcel of land, that remains an asset of the people of Trinidad and Tobago, and therefore there is no cost that can be attributed to the withdrawal as a consequence of the withdrawal.
Honourable members, question. Prime Ministerial questions time is now spent.